My name is Reagan Golden. I'm doing my head-to-toe assessment final for nursing 316. I'm going to do my room scan. Floor. And the ceiling. And there's nothing on my phone. Alright, I'm going to knock, come in, and introduce myself. Hello, my name is Reagan. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth for me?
It's Rihanna Golden, 9/29/01.
Alrighty, I'm going to do some hand hygiene and close your curtain for some privacy. Note about general appearance. I would note that the patient is well nourished. She's got about medium build. She's calm and cooperative, and her speech is clear. Can you tell me what day of the week it is?
It's Wednesday.
Can you tell me what month it is?
It's July.
Do you know where you are right now?
Yes, at home.
Do you know who the president is?
Joe Biden.
And I would note that the patient is alert and oriented times 4. All right, I'm going to go ahead and do a head-to-toe assessment on you. I'm going to start with doing a skin assessment. Have you had any past skin diseases, rashes, lesions, anything like that?
No.
Any hair loss or excessive bruising?
No.
Any itching?
No.
Alrighty. And then I'm going to go on to inspect. I'm going to look at your skin, on your arms, and your legs. We would note that the patient skin color is consistent with genetic background. The skin is warm, it's pink, and it's dry, no excessive moisture. We would test skin turgor, which is less than 2 seconds. And I would also note that the skin texture is smooth. Alrighty, and then I'm going to move on to a heart/neck assessment. Have you had any recent chest pain?
No.
Any shortness of breath?
No.
Any recent weight gain?
Mm-mm.
Any swelling in your feet or ankles?
No.
How many pillows do you sleep with at night?
1.
Do you get up during the night to go pee?
No.
And do you have any past heart disease or family heart disease? Alrighty. Then I'm going to go in and first I'm going to percuss. Any pain or tenderness?
No.
I would note no pain or tenderness. I'm then going to percuss. I would note resonance and resonance to describe it. I'll then move into auscultation here in just a second. I'm gonna test your jugular vein distension. If you could scoot out, you could stay seated, but just scoot out towards the edge and then lean back for me. And then turn your head that way for me. All right, and then the other way. Okay, and I would note that there was no jugular vein distension. All right, I'm gonna test your carotid pulses and just breathe normally. All right, you can sit back up like normal if you want. And then I'm gonna use my bell. All right, I'm gonna have to take a deep breath in and hold it. And then breathe out. And then breathe in and hold it. And breathe out. I would note that there is no bruit noted. And then I'm going to go ahead and listen to your heart sounds. I'm going to use my diaphragm. And I'm going to start here. Pulmonic, aortic. Pulmonic. Herbs. Tricuspid, mitral. I would note that S1 and S2 are present, and then I'm going to stay at the apex of the heart and listen for a full 60 seconds to get the apical heart rate. I got a rate of 88 beats per minute. Alright, and then I'm going to move on to your lungs and your chest. Have you had any recent shortness of breath?
No.
Any pain with breathing?
No.
Any recent cough? Any recent swelling or weight gain? Do you smoke?
No.
Alrighty. I'm then going to go into palpate. Do you have any pain or tenderness? Alrighty, I would note there's no pain, tenderness, or crepitus. I'm going to have you go ahead and say 99 until I say stop.
99, 99, 99, 99, 99.
I would note that tactile firmness is intact. I would go back to inspection. I would note that the patient's shoulders and chest are symmetrical. Her work of breathing is effortless, unlabored, even, regular. And then I'm going to percuss. I would note resonance in all lung fields. And I'm going to go ahead and listen to you. Just go ahead and take big deep breaths for me, in through your mouth, out through your nose. I would note the patient's lung sounds are clear and equal bilaterally, and I would also note through inspection that the patient's AP ratio is 2 to 1. All right, I'm gonna go ahead and have you stand up for me, and you can sit, just kind of turn your back towards me. Yep, just like that. All right, I'm gonna start with inspection. I would note the patient's posture is symmetrical, and her it's aligned. Her shoulders and her chest are also symmetrical bilaterally. I'm going to go ahead and palpate. Any pain or tenderness? I would note no tenderness or crepitus. Go ahead and repeat that 99 for me.
99, 99, 99, 99, 99.
Tactile firmness is intact. Percuss. I note resonance in all lung fields. All right, and then I'm gonna have you, I'm gonna hold back here and then have you take a big deep breath in for me. I would note lung expansion is equal bilaterally. All right, then you go ahead and turn back around. Have a couple more questions for you. Have you noticed any swelling in your feet or ankles or legs? Any new lesions, redness, itching, any pain? Any family history of artery or vein disease, anything like that? Alrighty, I'm gonna assess first through inspection. I would note that the patient's, I'm gonna go ahead and test for cap refill. See this one? Cap refill is less than 3 seconds. I would note that there's no lesions, no redness, no swelling in the hands or the feet. I'm gonna go ahead and test all your pulses. I'm gonna test radial, ulnar, brachial, popliteal, dorsal pedis, on the top of the foot, and then the tibialis, and the interior of the foot, and the ankle. I would note that all pulses were +2 in strength, and then I'm going to go back to the radial pulse and count for 30 seconds to get the radial pulse rate. And I got about 42 in 30 seconds, so her pulse rate would be 82 beats per minute. I'm also going to go back down to her legs, and I'm going to assess for edema in the lower legs and the feet. I'm going to push down for 5 seconds and then release. And this side. I would note that there is no edema present. And then I'm going to go ahead and have you lay down on the couch flat, and we're going to do an abdominal assessment on you. I would also go back and catch myself that during the posterior or anterior lung and thorax assessment, I would inconspicuously count the patient's respiration rates and note that she was within normal range, around 12 to 20 breaths per minute. Alrighty. Just get you closer. Have you had any recent abdominal pain?
No.
Any changes in appetite?
No.
Any nausea, vomiting? When was your last bowel movement?
Today.
Alrighty, first I'm going to inspect. I would note that there's no lesions, no redness, no swelling. I would note that the contour of the patient's abdomen is rounded. And then I'm going to listen. I'm going to start in the right lower quadrant with my bell and listen until I hear lung sounds. I would note that the patient's bowel sounds are normal, active. Any pain or tenderness?
No.
Alright, and then I'm going to percuss. Any pain or tenderness? I would note tympany in all 4 quadrants. Then move on to palpation. I'm going to do a light palpation first. And then a deep palpation. I would note there's no pain, tenderness, no masses or organomegaly noted. I'm then going to have you sit back up and face that way so I can get to your back. Any pain or tenderness?
No.
Then I would also note that there's no CVA tenderness.